Welcome back to your well-being channel. Today we have a great episode for you guys. We're going to be speaking about type 2 diabetes and DKA, diabetic ketoacidosis. And why are we going to talk about that? Because your girl here was hospitalized about 2 months ago in the ICU for diabetic ketoacidosis. But before we start that, once again, I am Brenda. I am a massage therapist and life coach. And today we have a very special guest. We have Lisette Sanchez. She is my friend and colleague, and she has worked with doctors in the hospital. So she knows a lot about this topic, but I'll let her introduce herself.
Hi, my name is Lisette. I am currently a massage therapist and following my passion. But I started working at hospitals a long time ago. So I started working in a hospital as a nurse assistant first, and then I started moving to wound care, and then working with the doctors, receiving a lot of diabetic patients, receiving a lot of patients that had to go through this diabetes journey, because actually it is a journey. It's hard. So during the process, you learn a lot, and you learn to see and just to catch small things that actually start telling you that something is not right.
So, with that said, we are not doctors. We cannot diagnose or prescribe. This is an informative episode that we're hoping to give you insight. If you're a pre-diabetic, we're hoping that you can revert that. If you're a diabetic already, then we're here to be a supporting system for you. So with that said, let's talk about what is type 2 diabetes. Type 2 diabetes is a lot of things, but not to get too into the topic. It's basically when your body is not producing insulin properly, and that has a lot of complications. Let me tell you what happened to me 2 months ago. So I went through a stressful situation a day before. The following day, what was happening is I felt like I had a stomach virus. I started to get a lot of thirst. Then I started to feel dehydrated. And then I started to feel confused. If I would drink water, I would vomit, I would throw up. I know that sounds gross, but then I couldn't contain my body. I started to feel very weak. At that point, I know I had to go to the ER. So luckily, I rushed over there. They got me into ICU right away, and they told me I had DKA, diabetic ketoacidosis. Okay, so let's let Lisette tell us a little bit more. What is DKA, diabetic ketoacidosis?
So diabetic ketoacidosis is when your body is producing a lot of ketones in your system. So what happened is that your system, your body, is becoming acidic. So this is an emergency on your system. This is an emergency on your body. So you need to take it serious. So you can lose conscious, nausea. So overall, you are gonna still feeling that something is different, and your body, it's not working properly. You are not working properly. So you need to run to the hospital right away. So there is some things that I can do to prevent this, but at the same time, you always need to make sure, the best way that you can always make sure that your body, it's working properly, it's checking your glucose. That's one of the first things that you can do. If you notice that something is different in your system, you feel tired, your skin, it's super dry, your energy levels are super low, that's not okay. We know that it's not okay.
Right.
So your body, it's trying to talk to you. So listen to it.
And
something is different.
Unfortunately, we don't. We're kind of getting used to working like a zombie because we need to get things done. And it's very true what Lisette is saying. At that point, I really wasn't checking my sugar. I'm like, okay, who has the time? I need to go. I need to do this. I need to do that. Eventually, my body broke down. And what broke it down was a life event. So, being stressed, having matters that really, really rise your cortisol levels, it's a very important key that I need you to pay attention. And that's why we're doing this episode, because there's a lot of stress and anxiety and depression out there where massage is not a luxury anymore. It really is not. And your mental state is not a luxury either. That's why life coaching is important. So if you're going through this, it's a very big disclaimer. We need you to check your sugars, listen to your body, and really put priority first. What's more important for you, your life or your endeavor? And that's going to be your choice. But that's why we're doing this episode. And Lisette, can you tell me a little bit more? Can we go into a little bit more in depth why massage is important, or how can massage be important with somebody with diabetes, or just in general?
Okay, so there's two types of diabetes, right? There is diabetes type 1 and there is diabetes type 2. So on diabetes type 1, there's really no production of insulin. Diabetes type 2, there is some production. So your body is producing some. So both massage, it's so important because massage, first of all, help you with the circulation. The massage recommended for people with diabetes, it's the Swedish massage. It's something light, it's something relaxing, pretty much to promote the circulation. And that is so amazing, because what happened with people with diabetes is that their circulation is not properly working.
Right, it's stagnant. And let me add just a little bit to what you said. You said it's more of a Swedish, it's more something light. And I don't mean to, this is just a little bit of education when it comes to massage, okay? Sometimes we get the client that has not been to a massage maybe in years, and they get an hour, and then they want to fix everything in that hour. And guess what? We don't do those type of miracles. I wish we could. But for a type 2 diabetic person, or a diabetic person in general, we don't need something so deep, because the body's already, it already needs TLC. It needs tender loving care. So if you're gonna go and get a deep tissue, that's not the technique that the body needs, because the body needs to reduce stress. Maybe you're carrying layers of muscular density, of fibrotic tension. So you need to take it by levels, and also allow your therapist to guide you. So that's one of the points I wanted to add. Another thing that's beneficial for massage is for neuropathy. Mm-hmm. So do you want to add a little bit more on that?
Yes, also, we cannot perform a deep tissue because what about if there's some swallow going on?
Okay.
So the first thing that we want to do is to promote that extra fluid go out through the lymph nodes. So as you know better than me, because that's one of your expertise.
Yes. So lymphatic drainage, that's another thing. Working with the lymph nodes, that is not a deep technique, okay? That's actually manipulating the lymph nodes in the body to open up and reduce that swelling, that backing up. That's another thing that's very beneficial, to detoxify the system, to get all that junk out. Okay, that's a very good point. And what's your specialty when it comes to type 2 diabetes, Ms. Lisette?
You know, Brenda, has been so amazing actually. I have been a massage therapist for over a year, and it's something that I cannot even explain to you right now, but it's something that it feels like was there or has been there all this time, that it was just waiting for me to open it. It was this box hiding inside of myself, just waiting to be open. And that is so amazing. So I can set that my expertise zone right now will be all the people suffering from migraines, from chronic pains, from headaches, sciatic. Pretty much I can tell you that someone that gets to me and tell me right away, I'm in pain, I have been going through this, I'm going through a lot of stress, my doctor told me that my cortisol levels are all the way to the roof, I'm having migraines 3 times per week, my TMJ, they have a lot going on, really a lot going on. And that is so amazing that has been not once, twice, has been already several times that I get patients coming to me, guests, clients, however you want to call them. They came in with pain and they leave feeling so much better. I'm not gonna tell you that they leave the door pain-free, because as she said, we hope and we will love being able to do magic on just one session, but unfortunately we cannot do it. But we always give our best and people can tell. So my expertise can be making people feel better, caring for them, taking care of them.
Yes, I think that's one of the best expertise, actually caring for someone. And that's very true. Another thing I would like to add to all this topic is the emotional support somebody needs if you're going through whatever disease you want to put it. There's always the opportunity for you to belong to a supporting group, and why the mental state is also important, because being sick or having some sort of disease plays tricks on your mind, and sometimes you're not understood. You can be comprehended, but sometimes, since whatever other person doesn't have what you have, they don't understand. So always joining a support group to be part of, that's going to be important. And of course, we're going to invite you to the self-love group, and we're going to invite you to Lisette's social media. But I'm going to be very honest with you right now. Can I be honest? Can I have your permission? The type of self-love I teach, it's not the type of self-love where you're going to go shopping, where you're just not going to do anything, because that's not what I'm talking about. The type of self-love I'm going to teach is about taking action. And if you're not willing to take action, things won't go very far. So I'm letting you know right now. And talking about going very far, I have a sweet tooth. And that's how I got sick in the beginning, right? Part of it. So talking to Lisette, she does this fat bombs and some dates, and I would like for her to talk to us a little bit more about it. I'll be very honest with you, and I'll put a screenshot of the treats she made. She was giving me the explanation and it really went over my head. All I wanted to do was try these treats, but nonetheless I want you to be educated, and I want for her to tell us, and she woke up very early today just to make these fresh, for her to tell us what she did. And they're right here. Ms. Lisette, and you can start with whichever ones you want.
Okay, I know that it's hard. It's hard for anyone. Actually, that's what we were just discussing. That it's so hard, like this healthy lifestyle. But you know what? Having a support group around you, it's so amazing. It's great because it totally helps you building trust on yourself. Because guess what? One day you can do amazing, but then if you do wrong the next day, it doesn't change everything around you. You're a human being, so you can make mistakes. I do so many mistakes. It's like I have this battle that I try to win every single day, but then one day I ended up eating something that I know that is not the best for me, but then I try to go back on track, and then the next day I try to pick the right things and do the right thing, and I always try to push myself to be a better person one day at a time.
And I'm laughing because I remember I was telling her, I'm like, listen, I've been eating biblical bread and that's not working. I was eating Ezekiel bread. And even though it's a biblical bread, I thought it was going to do wonders on me. But guess what? Having too much of it, it's not going to work. So just be mindful of those things too. I'm so sorry. I just had to share this with you because I thought it was funny. But continue, Miss Lisette.
So, being on this weight loss journey, being on this healthy lifestyle, it's hard. It's hard, but just working one day at a time, I believe that we can do it. And this is how I start with the fat bombs and the energy bombs. Has been on and off all this time. And every single time that I try to go back on track, I'm like, okay, I'm going back to my basics. So fat bombs, what are the fat bombs? The fat bombs, so let me just go back. On the ketoacidosis, your body is breaking up the fats in order to use them as fuel to get the energy that your body needs to keep moving, right? And Brenda and I, we can tell you a lot about it because we use our body a lot. And sometimes having the 1 hour or the 2 hour services really drain a lot of the energy that we have because, yes, we invest a lot of energy, and sometimes we need that extra support, that extra energy shot. And we try to get it from healthy sources, which is, it's hard to have all the time to make those treats, but we can do it, right? They really don't take long, and actually they taste pretty good. And just having in mind that you are gonna be eating the right thing, either from normal sugars, or not calling them normal sugars, but it's more simple sugars, or simple, just leaving it simple ingredients. That's great. So the fat bombs, what are the fat bombs? The fat bombs are pretty much a treat that you can get on the afternoon, and that is not gonna really affect your blood sugar levels because the grams of sugar that they have overall, every piece, they're really low. Actually, they are from 4 to 6 grams of sugar total per piece. Meanwhile, if you compare it to a Snickers bar or a regular chocolate bar, we're talking about 21 grams of sugar only in one piece. So the difference, it's amazing.
It's major.
And not just that, Brenda, but the simple ingredients that we use to make them versus you really don't know what you're putting on your body.
Yeah, guys, that's true.
So that's a big difference. And price-wise, they're way cheaper.
So that's the fat bombs, and I'm just gonna touch this one to show you guys. Pretty much it's a little bomb, it's a little bolita, and it looks really good. That I really want to try it now, but I'm gonna be patient. And then we have some other ones. I believe these are the dates with coconut. And then she'll talk about the dates with coconut too.
So I love those because if you are gonna be, you can take those in the morning, of course. Your sugar levels, they have to be stable. When I'm saying stable, they have to be between the 70 to 100 in the morning in order for you to be able to eat them. Or check with your doctors how your levels doing and everything, because the dates, they're simple sugars, but It's sugar. It's fructose. So it's gonna give you that extra sugar on your system. But if you are gonna be performing some exercise on the morning, like they're great. If you are gonna perform something, if you are gonna be doing a walking, if you are gonna be running on the morning, if you are gonna be walking up your dog, Brenda, in the morning, and you need that extra shot of energy in the morning, those are amazing. If you are going to the gym, if you are gonna be having a service, giving a massage, you can take something like that because there are simple ingredients. It's a date and it has peanut butter, it has pecans, and it has 85% chocolate that is covering the date, and then it has coconut flakes on the top. So just simple ingredients, a little bit more sweet than the fat bombs because the fat bombs, it's it's cream cheese, it's peanut butter, it's 85% chocolate, dark chocolate, and it's cocoa powder and stevia powder. So simple ingredients as well, but the difference is that between the fat bombs you can get from 4 to 6 grams of sugar. Meanwhile, the date, it's gonna give you an estimate of 20 grams of sugar. So the difference, it's pretty big, but that's why I was telling you that if you are gonna be performing an activity in the morning, you can eat even half of it in the morning and it's gonna give you the boost, the energy boost that you are looking for.
So half of it, I cannot eat the whole thing.
You can eat the whole thing if you are gonna be performing an activity that is gonna require a lot of your energy. Yes.
Okay. And is there a difference between the coconut dates and the sea salt dates that they also look delicious?
Yes, so the sea salt, instead of having peanut butter, it has almond butter as the filling. So those are the two differences. And let me tell you, Brenda, that's something so amazing that we can also do with the fat bombs. So if we remove the dark chocolate that it's covering them by the outside, making it look like a truffle, instead of using the dark chocolate outside, if we replace it with coconut flakes or cocoa powder, we can lower the gram of sugar. So instead of having from 4 to 6, it can be around 2 to 3. So that is so amazing. So really, the sugar that you are getting on the fat bombs, it's super, super low. And I'm saying this taking in consideration that you are just following the 1800 diet or maybe the 2000 calories per day.
Okay. So, Miss Lisette.
Yes.
I have a question for you that just came to mind when you were talking about having fasting sugars from 70 to 100. Is there a tip that you can give us on what is the best approach? So, Miss Lisette, before we continue, I know you're not a doctor and I know you cannot diagnose or prescribe, but we know this is an educative episode. In your experience, what do you recommend would be the best option to break a fast?
Okay, so according to the knowledge that I have, not really knowing much because I'm not an expert, I'm not a doctor, I'm not a nutritionist, just from friend to friend. What will be the best advice that I can give you as a friend? Bone broth.
Made or bought?
Well, the best thing that I can recommend, it will be made, but you know that you and I will live on the go. So
bone broth. Guys, I do recommend a brand that I do take, and I'm not being sponsored by them or anything. It's like Dr. Kellyanne, which it's funny, it stands for DKA, not Diabetic Ketoacidosis, but you buy it, it comes in a pack of 21, and what you do is just open the pack, put some hot water, and drink it. That works for me. I'm just putting it out there if you want to try it. or if you want to make it yourself, by all means. But if you know me, you know the kitchen and I do not get along. So that's a tip for you guys. And thank you for that tip, Miss Lisette. The other thing, Miss Lisette, that I want to do is I've been wanting to try the fat bomb. Is that the time where I can try it?
Yes, Brenda. It is your time.
Been waiting for this moment. Let's try it. So tell us that's chocolate and what else?
It's cream cheese,
Peanut
butter, stevia, cocoa powder, and dark chocolate.
Oh wow. It's not chocolate, it's the cream cheese with cocoa.
The cream cheese with the peanut butter and cocoa powder. Yes, and sweet.
This is crazy, guys, because honestly, this is what my brain was thinking. I'm gonna get a rush of sugar, of like that high sugar. My body's gonna rush and feel it, but I'm getting a very total different taste.
What do you think?
I'm getting the hit of chocolate, and it's that chocolate that doesn't make me feel sick, like if it's a Reese's or something like that. The cream cheese makes it feel very, very clean, where I don't feel like, whoa, it just hit me, I ate something I shouldn't, and then I still start feeling guilty. And actually, that bite that I took, it's very satisfying.
That's because of the cream cheese.
It's just like
it gives you like the satisfaction that you have been looking for.
okay, wait, I just have to go this deep. I'm almost having like a spiritual connection. It's weird. It's weird, listen. I'm serious.
That is so amazing.
I feel like I had like a cacao ceremony type of deal. This is crazy,
Love
guys. No, I'm serious. This is crazy. This is intense. I'm gonna have a little bite and then I'll put it on my plate. Oh my god, this is so crazy.
So that's why I was telling you, imagine that on the afternoon that you are craving something sweet, but you feel the need, the satisfaction need that you need to meet, and you get to your fridge and then you get one of those. It's gonna totally give you the satisfaction that you have been looking for, and guess what? Your body will be totally fine. You are not gonna have the need to look for something else. And that's what happened to us, is that most of the time we don't have something like that available to us, and we ended up just, it's like going back to your ex.
Ooh.
That you know that is gonna hurt you, but guess what?
You haven't changed yourself, so you're going back to the same pattern.
Yes, going back to the bad habits. And that's what we don't want to do here. We want to, as a team, as a group of people together, what we want to do here is that we want to help each other to build the right relationship between your conscious, your soul, and your body.
Indeed. So let me ask you a question, Lisette. If we want the recipe, if you're selling these bombs that are really the bomb, get it? How can we do it? Okay. So Miss Lisette, where can we find you if we want to book a massage, if we want the recipe to the dates and the fat bombs, which are the bomb, like I already said, and if somebody wants a massage from you or just wants to connect with you, where can we do that?
Perfect. I'm gonna leave all my information, my social media, on the description below, so you can find me if you want to book an appointment, or if you want the recipe, or if you want to order anything. I will be more than happy to help.
Yay. And for me, you already know I'm going to do the same thing. My information is going to be in the description below, all my social medias. If you want to combine life coaching with massage and want to work with us together, we can create a custom package for you. If you want to do massage first and then do life coaching, that's also a possibility for you. Whatever it is, just remember you have a support system. You know, all the information I release is not just wellness, it's actually for well-being. And don't remember to use the self-love, but the self-love that I told you, you need to take action. Lisette, thank you so much for joining us today. It has been a great episode and it has been a great experience.
Brenda, I'm so grateful for your invitation. I'm so happy to be here. And thank you so much.
Thank you. And if you guys could just feel the energy, I mean, I hope it just translates into the screen. Thank you.
Thank you.
Bye-bye. Agarrar una de estas. Like you're gonna bite it, and then I'll bite my little thing again. Okay, cool. And put a little bit of this conversation. Listen, this is crazy. Te lo juro que yo estaba esperando así. Me va a dar un rush. Porque my addictive behavior. I'm like, quiero el chocolate, quiero el dulce. Like the fix, right? But when I bite it, haz de cuenta que mi mente like what? This is not what I was expecting. But it was satisfying. And I swear to you, I almost had like this spiritual connection. It was intense.
So you liked it?
Mm-hmm.
Isn't it sweet?
It is, pero no es de ese sweet que te digo.
It's different. And the reason that I was telling you about eating half of it, because as you notice, they're pretty big.
Yeah, but as you notice, se te encanta comer. Good.
Brenda, and I didn't brought the cookies or the brownies. It would totally blow your mind knowing that the brownies, they are made with black beans.
Okay, this is the thing. Yeah, this is off record. Espérate. Oh, anything else you want to add to this? Let's do a little share with the little cups.
Yes.
Para que tengan ahí.
I'm not.
Okay.
Brenda, where are the napkins?
Oh. Ayun na sila. Cheers. Cheers.